Good afternoon. We're Group 6, and today we'll be discussing the lipid profile test. There are a number of tests that fall under this heading, such as the serum cholesterol test, serum triglyceride, high-density lipoprotein, and low-density lipoprotein test, as well as cardiac risk assessment. Today I'll be discussing the first test. My name is Tony Winter. I have my colleague Tony and Howard, who will be telling you more about the serum triglyceride test. Shanique Nicholson, who will be discussing the high-density lipoprotein test. Stacey and Williams, she'll be expounding on the low-density profile, lipoprotein test, and Peter Banks, who will be doing cardiac risk assessment. So first, what is a lipid panel? A lipid panel or a lipid profile test measures lipids, fats, and fatty substances used as a source of energy by our body. A serum cholesterol test measures various elements in the blood, such as high-density lipoprotein and low-density lipoprotein.
For this test, how do you prepare a patient for this test?
So for a total cholesterol test, the patient can eat or drink beforehand, but if they're doing a complete lipid panel test, they are to fast for 9 to 12 hours.
Okay.
Yes.
Okay, Miss Winter, so how is the test done?
So the serum cholesterol test is performed by the phlebotomist tying a tourniquet around your hand. So it pushes all the blood flow to your vein. They then insert a needle into the first visible vein, and then a tube is attached into that butterfly needle to collect the blood sample.
Oh. So after all of that collection of blood, how is it handled? Like, how do you handle the samples?
So the sample, once it's collected into a glass tube, a red top vacuum, it is then left to stand for at least 45 minutes at room temperature to allow clotting. If it is disturbed before that time, then clotting would not be complete, and then the test would be inaccurate. After that is done, it is put into a centrifuge at 1500 grams for at least 30 minutes to spin so that it separates the blood from the plasma or serum. Once that is done, then the specimen is kept frozen at -20 degrees Celsius until it's ready to go to the patients to give them their results.
After the test is done, how would I know if I'm at risk?
So to know if you're at risk, a normal cholesterol reading would be below 200 milligrams per deciliter. If it is too high, then it's going to be above 240 milligrams per deciliter. And if you're right at the borderline, it's going to be between 200 to 240 milligrams per deciliter.
Okay. Thank you.
A serum triglyceride test measures the amount of triglycerides in your blood. Triglycerides are a type of fat in your body. If you eat more calories than needed, the extra calories are changed into triglycerides.
So for a serum triglycerides test, how would you prepare the patient?
So blood should be collected after a 12-hour fast. That means no food or drink except water.
Okay. So explain to us, how is the test done, please?
The test is done by tying an elastic around the patient's arm. The area the sample will be taken from is cleaned using an antiseptic. A small needle is inserted into the vein, into the patient's arm, and the blood is collected in a test tube or vial. The patient may feel a little discomfort for a few minutes.
How will the sample be handled?
a container or tube is preferred. Serum gel, but the red top tube is acceptable. Specimen volume is 0.5 milliliter. Serum gel should be centrifuged within 2 hours of collection. Red top tube should be centrifuged within 2 hours of collection and aliquoted if used.
Okay. And how would you interpret the results after doing such a test?
Okay, so triglycerides are normally measured in milligrams of triglycerides per deciliter of blood. So for adults, results are normally categorized as follows. Normal triglyceride range is less than 50 milligram per deciliter. Borderline high range is 50 to 190 milligram per deciliter. High triglyceride range is from 200 to 499 milligram per deciliter, and the very high triglyceride is 500 milligram per deciliter.
Okay, thank you.
Okay.
The high-density lipoprotein, which is commonly known as the good cholesterol, it helps to keep the arteries open and your blood flowing freely. It is called the good cholesterol because it helps to carry away the low-density lipoprotein cholesterol. What the test do is it measures the level of good cholesterol in your blood. Cholesterol, which is a waxy substance found in all cells in the body, it helps to build your body cells.
Okay, so how are the patients prepared for this test?
So for this test, fasting serum is preferred. Only clear fluids are allowed. No tea, coffee, or milk until after the specimen is collected.
And how is the test done?
During the test, sample is run from your vein in your upper arm with a small needle. You'll feel a sting where the sample is taken from. It is quick and relatively painless. About 2 milliliter of serum or plasma, minimum of 0.2 milliliter, will be collected into a 3 milliliter yellow or green tube top, which is taken to the lab for testing.
Okay, so after collection of the specimen, how is it handled?
When you're handling samples like with serum or plasma, always wear liquid impermeable gloves, which is water or plastic. You avoid contact with serum, cover any scratches or cuts on fingers and hands, and wear gloves before handling serum. You store all samples in sealed containers, and you allow to centrifuge at 1,100 to 2,000 grams for a minimum of 10 minutes to allow clotting.
Okay.
So, normally, how do you interpret this test?
Well, the results, you can expect the results back in at least 36 hours, and if you're a male and you get a range under 40 milligram per deciliter, that means you're at risk of getting a heart disease, while females is a little higher. Females are less than 50 milligram per deciliter. The normal or the okay range would be greater than 60 milligram per deciliter.
Alright.
Thank you for sharing.
Okay, so what is Ldl? It is a tiny blood made up of the outer rim of lipoprotein with cholesterol. Its full name is low density lipoprotein. It is often called the bad cholesterol because it collects in the walls of your body, blood vessel, rising the chances of health problems like heart attack.
So why is the test performed?
Okay, so this test is normally performed. It is usually done to determine the risk of heart disease. The Ldl test is usually done as a part of the lipid panel, which also checks the total cholesterol and triglyceride levels. LDL carries cholesterol to various tissues throughout the body. Too much LDL commonly causes bad cholesterol is linked to cardiovascular disease. So this lower the risk of heart disease or stroke.
Okay, so how do you prepare a patient for such tests?
A patient is you normally tell the patient not to eat or drink anything for 9 to 12 hours before the test is done. However, fasting may or may not request. It's optional for the testing. So the healthcare provider will normally tell you whether or not you will be going on fastings or not.
Okay. And how is the test performed?
Okay, so this test is normally performed. Blood is drawn usually taken from the inside of the elbow or the back of the hand. The site is usually to be cleaned with germ-killing medicine. The healthcare provider wraps an elastic band around the upper arm and apply pressure to the areas that makes the vein swell with blood. A needle is inserted in the vein and the blood is collected in a airtight vial of syringe. Preparation may depend on the specific test. In children or infants, a small tool called lancet may be used to puncture the skin and make it bleed. The blood collects into a small glass tube called peptide or on a slide of strip. A bandage may be placed over the area if there is any bleeding.
Okay, so how would you interpret the results?
Okay, interpretation is done less than 100 mg Ldl is optimal. 100 to 129 is near optimal. 130 to 159 mg Dl is the borderline high. 160 to 189 is high, and the 190 mg Dl is above, which is very high.
Risk assessment. What is cardiac risk assessment? Group of tests and health that have been proven to indicate a person's chance of having a cardiovascular event, such as heart attack or stroke.
So how do you normally prepare a patient for ECG?
Or preparation of patient for ECG. Avoid oily or greasy skin creams or lotions the day of the test because they can keep the electrodes from making contact with your skin.
Okay, so what are the equipment used?
The equipment used are patient monitors, EKG machines, cath lab, tables, fluoroscopy, C-arm fluoroscopy, cardiac ultrasounds, defibrillators, balloon pumps, heart-lung bypass, stress test systems, infusion pumps, diagnostics, vascular Doppler, AEDs, surgical instruments.
So how would I determine the level of my ECG?
Normal level mg Dl ratio greater than 4.5 is considered a high risk for coronary heart disease.
Okay.
Okay.
Thank you.
Well, ladies and gentlemen, thank you for sharing. So today we discussed the various lipid panel tests. We have come to the end of our discussion. So today, my colleagues and I discussed the various tests that are done under the lipid panel or lipid profile heading. We discussed how patients are prepared, how you interpret results, how the samples are handled, and the methods used or equipment used to do the various tests. Concluding this presentation, please stay away from KFC and Burger King
And fatty foods.
and eat more.
Vegetable and fruits.
Exercise, please.
Yeah.
Thank you.
Exercise. Thank you for watching. See you next time.